Hi everyone, very good evening guys. I hope I'm audible and visible to all of you, and I hope all of you are doing extremely well, especially the INI-CET aspirants, because now officially you are in the last lap towards this exam in November. And trust me when I say that, the last lap is always the most crucial. We call it the make or the break. So you might be obviously a little underconfident at this point of time, a little scared, which is inevitable. It is of course going to happen as you near any exam. So that part of your thinking is totally on track, because every student goes through that. And to calm your nerves a little, here we are as with a new thing that we are going to come up on the YouTube channel, and that is LRR. So I'm probably going to take 15 to 20 minutes of your time today and going to orient you about it, so that first, as I said, it can calm your nerves, and secondly, you know exactly what to go ahead with in the month of October. So as you can see on the screen, we are at LRR. That is what we've called as the last resort revision. And all the queries that you have will be answered within 15 minutes, and I'll give you a timetable, the number of hours, the questions, and the entire outline of this plan. So this is going to be something like a marathon that you had in the past, which is going to go on for a total of 14 days. When does it start? It starts on October 5th. And this is going to cover all your 19 subjects. Now, what must be coming to your mind is that usually we have YouTube live sessions and that's about it. So we decided that this time we are going to add something onto it, so that you feel a little more confident as you keep solving more questions, right? So I'm going to brief you on that, but I'm getting a lot of queries regarding who should be joining this. Is it only for the INI aspirants? So let me tell you, LRR is something that we have started and we are going to continue. So there are going to be 3 set of LRRs for, firstly, we are starting with INI-CET aspirants. Then of course, we are going to have a separate LRR when the FMG exam is going to come, and then we will have another one for the NEET PG students. So there are going to be separate set of these marathons that will be conducted. But of course, every session is open to all. If you have time in between your schedule and you want to practice more questions, of course, you can join in for this particular program that we are starting for INI-CET. Of course, the NEET PG students are most welcome. But yes, letting you know, the separate LRRs will be conducted closer to your exam when the time arises. Now, many of you had also written to me a question which I don't think should be a question, but at near the exam, everything comes up as a doubt. Let me just tell you that these are end moment revision sessions. This is, don't expect that you're going to, if you only read this, you're going to get a top 10 or a top 50 rank or a top rank in this. Reading alone from LRRs is not going to help. This is a supplement that we are providing, because you really don't know what to read in the last 1 month. That's always a dilemma, that's always a doubt. So the last 1 month plan we are getting for you, and this is not a replacement. So you will ask me what are the things that I have to do before the session, and then we'll join in. So moving on and letting you know what is the entire plan that we are going to have, and then I'll give you more details. This is how we have structured LRR. So we are, first and foremost, till now, for students who've joined in a little late, this is going to be a YouTube series which undoubtedly remains free for all, so there is no doubt about that. And we have divided it into morning and evening sessions. So the morning session that we are looking out for is going to be at 12 noon, and the evening session is going to be at 5 p.m. Both of them are going to be on the YouTube channel. And right now you might be thinking that how can I attend 2 sessions every day? It is going to get a little heavy for me to take out that much time. But every day you don't have 2 sessions. There are certain days where you have 2 sessions, and then there are certain days where we've kept only, if you know, for example, say I'm teaching pathology, I might want to take a 2-hour class. So then that day you don't have an evening session. You have only 1 session. So we have made a timetable so that we don't want to burden you with so many live hours. You have your own timetable also that is going along. So this much is clear with everyone. You have a morning session at 12, you have an evening session at 5, and that's not it. Whatever subject that you will be reading, like say for example you read pathology with me at 12 o'clock, right after that you will go to the app and there will be a subject wise test of 50 questions that will come up in front of you. As soon as my session will finish, you will have a subject test available on the app. This will be on the app, of course, right? So this much of it is also settled. As I can see a lot of queries coming in, but as you must be listening to me, your queries are getting sorted side by side, right? This is gonna happen on the YouTube series. This is going to be a morning evening session. After that, the test, of course, guys, that cannot be on YouTube. The test is going to be on the app only, and subject wise tests. So every day for 14 days, you will have subject wise tests. But what about mock tests? So we've also kept 2 mock tests. One of them is on 11th of October. One of them is going to be on 25th of October, and the mock test will have a total, just like your INI-CET, it will have 200 questions. Mock test is going to be free for everyone to attempt, right? So this is the entire plan. As I said, we are not leaving you at any point of time, neither are we giving you just live sessions. We want, if you read micro with me, right after that you attempt questions. After a few days you attempt a mock test. This is going to go on for the entire 14 days, and for students who are asking me the timeline, it is starting on October 5th. So let me give you a more clearer picture on this. This is the timetable, guys. Have a look at it and you will get more confidence. If you want, you can take a screenshot, which was not necessary because we're going to post it on Telegram, Instagram and the app, but still for your satisfaction, because taking screenshots and storing it in some part of your phone always gives you a feel good factor, I believe. So here you are, starting on 5th of October. 5th of October, we've kept only one session, that is an evening session with the ophthalmology. And right after this session, so someone was asking me regarding the duration. Duration approximately 1.5 hours. We'll try our best. I mean, all the educators are trying their best to consolidate things and give you the most dense, crisp and concise content without taking too much of your time as well, right? So we have one session. Right after this, what will you do? YouTube session kara, you finished it off, you jump onto the app, and in the app you are going to test yourself with 50 questions, which will be available as subject wise tests. Let's move on to the next day. You have 6th of October. Here you have 2 sessions. Morning you've got dermat. Now for shorter subjects we've got one like dermat ke liye one session is there, but for volatile and bigger subjects like anatomy, you can see we've divided it into 2 sessions, part 1 and part 2. So here you've got 2 sessions on the same day. So how will your subject wise test be? You will have how many questions? This day you will have to attempt 100 questions, 50 dermat, 50 anatomy. Let's move on to the next day. 7th of October becomes, again, anatomy is a heavy subject. We can't club it with too many things. So it's a single session in the evening. So you will actually realize every day we are not bombarding you with 2 sessions. All of us have sat and planned this in a meticulous manner that you can finish off and you can be on track with us. You shouldn't have too many backlogs. Right after that, you move on to the app and you practice your 50 questions. Let's move on to the next day, guys. 9th ko you have a short subject, that is anesthesia, again followed by 50 questions, and you have pharmac part 1. Morning, evening, 12 o'clock, 5 o'clock, that is how your life is going to revolve now. Next, going on to 10th of October, you have PSM and you finish off your pharmac part 2. Timings remain the same. I'm scanning through the rest of the schedule. 11th, you've got a short subject in the morning and a short subject in the evening. So I think if I would have been in your place, I would have kept 11th of October. I would have woken up in the morning, done my rapid revision of psychiatry. Quickly in 4 hours, I would have revised entire psychiatry from my rapid revision notes, and I would have joined sir's lecture at 12 o'clock. And I would have, revised that in the LRR. Then I would have, after that, post lunch, I would have decided that rest of the day I will study orthopedics and I will sit down for the 5 o'clock session. So in a day, half day, I will finish off 2 subjects. Personally, this is what I would have done in my last lap towards any exam that I would have been preparing for. Okay, moving on to 12th of October. Again, you've got 12th and 13th. 2 big subjects, part 1, part 2. Both days you have OBG in the morning and you have ENT in the evening, and the questions are the same. On 12th, 50 questions, so you will practice 100 questions. On 13th, again 50 questions, you will practice 100 questions. But let me tell you this over here, that on 11th of October, I hope you remember, you have reached midpoint of your YouTube sessions. You've had a lot of YouTube sessions. So 11th of October, we've kept a mock test of 200 questions, which is pretty much possible to do because this day we've kept all your short questions, all your short subjects. We've kept psyche and ortho, right? So with this, you can finish off your mock test also. Mock tests are free for everyone. Okay, this is a question coming up. YouTube sessions are totally free for everyone. The mock test is also free for everyone. The subject-wise tests that I'm talking about, they are obviously for the PrepLadder users. syllabus, because subject-wise test means we are preparing it from the clinical Q bank. The subject-wise tests are only for the subscribers, but the mock test and the YouTube sessions are free for everyone. Okay, that session is sorted. Now, by now, you might have realized that when am I going to come up and teach you? So 15th of October, because pathology is something which I would want to teach you for approximately 2 hours. So only one session on this day at 12 o'clock, and your 50 questions are going to follow after that. So only one session on this day. On 16th, I've given you a break. You come down with physiology in the evening. On 17th, you're going to meet me again in the morning at 12 o'clock with pediatrics in the evening at 5 o'clock. On 18th, we've kept radiology morning short subject, and surgery of course starts now. If you'll realize, we've kept surgery and medicine a little late because we want that you should finish off the allied subjects. Like for doing surgery, we want you should finish off radiology first. We want you should finish off anatomy first. Then we've got surgery over here. So it might look like a random timetable, but honestly, there's a lot of thought process that has gone into it so that you can get the best possible outcome from it. Okay, now by now you might have started missing me. So 19th and 20th of October, I'm gonna come back and teach you your favorite subject, and that is microbiology. So these are also gonna be 2 sessions in the morning. I'm not repeating the fact that after every session you will have a subject-wise test of 50 questions on the app. That remains copy-paste for every day. That's a loop in which you're gonna move. Every day you're gonna have that. Now let's move forward. We are almost towards the end of the series. That is 21st of October. We've kept something volatile because biochem is a subject, you have to revise it very, very close to the exam. And you know now that INI-CET tests you heavily on your pre and paraclinical subjects. So all these volatile things you have to revise once near. And that is why we've kept it for 21st. Then finally, once you're done with almost everything, you come to 2 days of the mega medicine, which is going to be a kind of a wrap up, and a 22nd in between. We've given you a day, a chota subject of forensic in between. One, you wrap up the entire thing, and in the end, to add the cherry on the cake, you have medicine. Although medicine is the entire cake if you come to think about it, but that bulky subject we've kept right in the end so that you finished all other 18 subjects by the time you reach. And finally, on 25th comes your last mock test, and that mock test is again gonna be 200 questions. So for those who've joined in late, this is your final timetable. Morning, evening, 12 o'clock, 5 o'clock. After every session, 50 questions of that subject are gonna come up. There are gonna be 2 mock tests which are free for everyone on 11th and 25th. Mock tests are gonna have 200 questions, and that was a 30-second recall of this entire session that you can think of. So this is the plan. And of course, as we go forward, you would want to ask me how many questions. So subject-wise tests that I'm telling you, we are going to have 50 questions, 50 minutes. So 50 questions, 50 minutes, this is going to be for the short subjects. Long subjects, do din hai na, like pathology is 2 days or pharmac is 2 days. So 50-50, they will automatically have 100 questions. So as many number of days, every day you have to solve 50 questions of that subject. That is the crux of the matter. And as for your mock tests, I think that I've already told you that the mock test is going to have a total of 200 questions, and this will be on 2 days, that is 11th and 25th. We are going to have important topics. Now, one last question, yes, many of you are writing to me that, ma'am, what is the content that every educator is going to cover? Like everyone's suggesting me that, ma'am, try to make path micro as comprehensive as possible. We'll sit for 2 hours, but padha do, like finish it off for us once and for all, so that that headache goes off from our head. So we totally understand that point also. And of course, you would want to ask me that what is going to be covered in this. So as educators, we sat down and we decided that, let's start first. First exam is INI-CET. INI-CET mein the most important thing is going to be the previous year question. So first and foremost, previous year topics have to be done. I'm not saying like, see, for FMG and for NEET, I say you have to do previous year questions. For INI-CET, I will not say you have to do previous year questions. I will say you have to be a champion of the previous year questions, because their strike rate from previous year questions alone is a 60%. So it's not just casually knowing about PYQs and PYTs. You have to be like a champion, a master of those PYQs, right? So all of us will teach you all the PYQs of the last 3 to 5 years. 3 years so karna hi karna hai, and 5 years till wherever we can extend. Apart from from that, we will then come down to teaching you the high yielding topics, images, like in my subject, images are a lot in radiology, in orthopedics, they will have images. In physiology, PSM, you have a lot of graphs, numericals, those will be. So as per the subject, things are gonna be incorporated. 1.5 hours is the timing, but let's be practical. Once you start asking doubts and you start interacting with the educator, it might go up to 2 hours, and I don't think you're gonna mind that, because it's going to cover a major chunk of that particular topic. But yeah, for the educator to be able to teach you, very swiftly, it will be great if you can revise that subject and come, because then, as I am teaching you the culture media, and if you've already read the culture media prior, then it will be like a rapid revision and an active recall for all of you. That is what is going to be there. And of course, this is all going to be live. If it's a YouTube session, it is all going to be live. So I hope that part of it is settled. If now you ask me, ma'am, keep everything aside, I have my INI-CET exam in November, what am I supposed to do? This is your mainstay of, if the main approach to the exam, I have to say, has to be rapid revision videos and notes, no escaping them. That is your mainstay for 1 month and beyond. Apart from that, what we will try is that in the LRR, we can take care of the Q bank, the subject-wise test, the the YouTube sessions, the marathon sessions, that part of it, we will try that we take care. So it's like a combined effort that we are going to try and keep up for this INI-CET exam, where you are doing your best possible and we will try to come up with whatever best we can. So that is the plan that you have, and that's about it. So I suppose it's pretty much settled. And again, for students who might feel that INI-CET people are so lucky because they are getting an LRR, but NEET PG and FMG students will also have LRR. So we have right now 60 hours that we are looking out for, because if we look at all the 14 days, this is approximately what is coming out as. This is the best, most concise possible way of wrapping up your course, right? Okay, so now any other question that I might have missed out? As I said, it's going to be a short session and I've pretty much given you all the information needed. PDFs, Dr. Next PG trivia. No, PDFs are not going to be provided by most. So that's the new PrepLadder policy, as you know. So, you'll have to take down notes. MCQ discussion like class, or is going to be, so Dr. AK, it's going to be a mix. See, there are some things which I would like, say for example, if I'm teaching you a clinical vignette, I want to teach you about, meningitis. I would want to first teach you a table, viral meningitis, bacterial, fungal, and then I will make you practice questions. So maybe first I would want to give you a concept of a table. Those things will be tabular form. Then I might be wanting to teach you direct some things which are factual. So I'll be like, just go through this MCQ and mug it up. We're not going to spend too much of time on it. So it's not going to be purely just questions or purely just tables. It's going to be a mix. So you just need to have that faith on the educator that whatever the teacher is coming and teaching you is the best that he or she feels is for your exam. After their experience of so many years, this is the best thing that they've got for you. And trust me, because I know what is happening behind the scenes, I know every educator is genuinely working very hard to give you that 2 hours, but such a consolidated and strong foundation in those 2 hours that it can give you a really, really good, boost towards the INI-CET. And will it be helpful? NEET students, you can join or you may not join. I mean, I totally leave it on you. If you feel sometimes you're studying all alone and you don't get that push on your own, and you might feel that if I attend a live session, I interact with students, I know what others are doing, and that gets me back on track. I mean, learning something is not going to harm you in any way. And eventually, this is also something that you will be studying when your exam comes up in March or whenever, right? So you need to know this. If you can join in, well and good, but there will be a NEET PG LRR also closer to your exam whenever the date is announced. Subject wise test, Dr. Cardiologist, of course there are going to be a new bag of questions which we've mixed from the previous Q bank and some new questions, so it's going to be a mixed bag for that particular subject. There's no replacement that is going to occur. Your old subject-wise tests are not going to go anywhere. All the subscribers, you are using the app, all your questions are going to remain as it is. This is just another bundled thing which we are going to give you as a kind of a surprise test, or a kind of, you don't know which 50 questions are going to come your way. A practice test is what you can call it. Right, so yes, I think we are settled. Any other questions? I'll give you another minute, guys. And all of this, many of you had a confusion, where is this going to happen? It's going to happen on the PrepLadder, the same YouTube channel which you're attending this session on. So it's going to happen on this. You can save it, subscribe it, or whichever way that keeps in mind that this is the channel which you have to get going on, and it's starting on October 5th, as you can see, right? This session is for all, of course, Dr. Arshad. I mean, it's a YouTube session. It's for everyone. It's open to all. This will be available till INI-CET. It's a live session, but of course the recorded version is always going to be available, so don't worry about that. You can highlight in your notes, if you feel that at this point of time you don't want to make new notes of the YouTube sessions, keep your rapid revision notes in front of you. I mean, the teachers are not going to teach you something out of the box. They're going to teach you something from their notes, but in a concise manner. So you can keep your RR notes in front of you, and as the teacher's teaching, you can mark those pages, mark those topics, and that in turn becomes a consolidated version as it is, right? Okay, so this is going to be for INI-CET, but later on we will have for Dr. Mayur, we will have for NEET and FMG separately also. But this is for INI-CET students, but everyone can join in, of course. Okay, and Dr. Karti, I think that is also sorted for you. In the month of November, we will have FMG LRR as well. So you can obviously follow that as and when it comes. Timings of the subjects, Dr. Krishna, I think you joined in a little late because I have already shown the timetable. So if you want, you can take a screenshot, or right after this, we'll be posting it on Instagram and other social media handles. So this is the timeline. Some sessions are in the morning, some are in the evening. Timings will always be 12 and 5. So if you're any time confused, the timeline that you're looking out for is 12 noon and 5 p.m. That's the timeline, and that's the entire YouTube channel, the entire timetable that I've got for you, right? Okay, so settled with the days, the timings, the timetable. Everyone who joined in late, I don't want to extend it further because we've discussed everything. Just replay and you'll get every information that you are looking out for, right? Okay, so thank you so much for joining in. And yes, starting October 5th, guys, we are trying to give our 100%, but you have to give your 200%, because, many students know that INI-CET is not similar to the other exams that are conducted. It's a little higher in terms of its level of the exam being conducted, but it is very much achievable because it has a set pattern. You just need to crack that pattern, and that pattern is getting a championship in your previous year topics. They really like to repeat the topics, but they will give you some kind of a slip or some kind of a catch in that topic that the question will not be the same. So you need to be a master of that topic. So if they've asked you a particular, say for example, ARDS and respiratory path has been asked once, then you should be a master of ARDS from path also and from medicine also, because that is a topic they will ask you again and again. So there are certain topics which of course we are going to teach you and mention to you also, and you just need to master those, and trust me, it is very much achievable. So these, as I said in the beginning, the last lap, trust me on this, is always the most important for any exam. So as I said, we are all going to give it our best, and we are going to meet starting October 5th, and I hope this helps you. But till then, if you have any other feedback or anything you want that should be added, for the educators also, you have time till October 5th. You can comment below and you can let us know, right? Thank you. Thank you so much, guys. And I'll see you soon when Path and Micro come up. Thank you. All the very best.